Welcome. Today, I want us to talk about the C-section recovery tips. My name is Nurse Ann. As we know, most mothers nowadays are going through C-section because of so many reasons that makes them to deliver through C-section. And therefore, there is a need for them to know some of the tips that will help them recover faster without complication. During C-section, our organs, especially our intestine, are manipulated, or rather they are pushed far away from the uterus during the cut. And therefore, we need to be very, very aware of what we expect after our baby has been removed. What I mean here is that we need to get some rest after C-section, because depending on the type of anesthesia you have used, there what we call spinal anesthesia and general anesthesia. Let us say at most 6 hours you should be active. You need to be active. You need to wake up from your bed and start moving around. Ambulation is very important. Walking around is very important. It's going to help you prevent some of the complications that comes after C-section, like constipation. Constipation can be very, very uncomfortable, or having gas can be very uncomfortable, especially to the wound. And therefore, through ambulation, you are helping your intestine to be active again, and therefore starting working normally, releasing the gas and releasing other things that are not supposed to be in. Also, during this ambulation, you are trying to prevent what we call blood clot. Nowadays, most of our C-section are done to the lower part of the abdomen, the pelvic region, and therefore there are some complications related to any pelvic region surgery like blood clot. When you walk around, it helps a lot to prevent the complication of blood clot. Also, ensure you empty your bladder more frequently. This is very important in that it's going to give chance or more room for the uterus to heal, and also prevent what we call postpartum hemorrhage, PPH. Therefore, ensure that most of the time you are emptying your bladder. Also ensure you empty your rectum. All this is to give room to the healing uterus, and also reduce pressure to the uterus and give room to healing. After you being active, it is good for you to check on what you are eating. You need to go slow on the type of feed you are eating. This includes, it's good for you to start with fluids, then graduate to light diet as it goes. Don't go fast on the food, because this might cause more complication that were not supposed to be there. But ensure you are taking food that has fibers, protein, rather balanced diet, and take in a lot of fluid. This is also going to help a lot when it comes to milk formation. Another thing, ensure you fix your baby on the breast almost immediately after delivery. So long as you are out of anesthesia, it's good for you as a mother to do it, to fix your baby on the breast. It helps to contract the uterus, therefore enhancing healing process. Also, ensure that when you are pain-free, your doctor is going to prescribe to you pain medication. It's very important for you to be pain-free, because you need to handle the baby, you need to walk around, you need to do so many things. It's good for you to be pain-free. So ensure you are pain-free. Just in case you have pain, communicate. And just in case you are walking around, ensure you are walking in an upright position. Why? When you walk bending, definitely this is because of pain. You are fearing pain. First, we have said we control pain. Now we have controlled pain. Ensure you walk upright to prevent you having scars. Your wound will heal with scars if you are always walking and bending. Check on the food that you are taking. Let it not be gaseous food. Yeah, it's going to make you uncomfortable. Also ensure that you are keeping yourself self-hygiene. Keep yourself clean. It's very important, because now you have a wound. We are trying to prevent infection. During surgery or after surgery, your doctor will have placed what we call wound dressing, like pressure dressing, upside dressing, or whichever type of dressing that will be there. But within 48 to 72 hours, this dressing will be removed. When it will be removed, you will only remain with a suture line. So you need to keep the suture line dry to prevent infection. These are some of the tips that are going to make your healing faster and effective.